Good evening, everyone, and thank you for joining us for our discussion about two public health crises, COVID-19 and climate change. My name is Andy Krasner, and I'm pleased to be a moderator for our discussion this evening. I'm a volunteer with Mothers Out Front, serving on the local Boston team and the Health Impacts team. I'm a mother of two children, Maya and Jonah. For those of you who are new to Mothers Out Front, we are a volunteer-led organization composed of mothers and others who are working for a livable climate for all children. We have staff in 5 states and people who are part of our movement in all 50 states. Our organizing principle is to build the power of mothers. We have a fierce sense of urgency to protect our children from climate crisis, and we use our collective power to influence policymakers with the goal of making structural changes necessary to address the long history of environmental injustice and to slow climate change. If you'd like to join our movement, please go to mothersoutfront.org. I went to the website 3 years ago, and I'm so thankful for the relationships I've made and for the work I have had the opportunity to be a part of. It's very easy, just go to mothersoutfront.org. Our discussion today about two public health crises, COVID-19 and climate change, is brought to you by the Mothers Out Front Health Impacts team, which supports local and state teams across the country by providing relevant, credible health information that informs our climate work. Today, we have the pleasure of presenting a discussion between Dr. Howard Frumkin and Sandy Naranjo. Sandy Naranjo was born and raised in San Ysidro and resides in National City with her husband and their children, Frida Ruth and Julius Joseph. Her passion for social justice grew when she came to the realization that her environment was designed to continuously oppress, exploit, and endanger her community. Sandy has 3 bachelor's degrees with honors, with concentrations in political science, political economy and economics, along with a minor certificate in women's studies from California State University of San Bernardino. She worked for organized labor and joined the environmental justice movement when she began serving as the National City Policy Advocate for the Environmental Health Coalition. Currently, Sandy is our very own California organizing manager at Mothers Out Front and focuses on mobilizing moms, grandmothers, and caregivers to advocate for a swift, complete, and just transition to clean, renewable energy. Our guest, Dr. Frumkin, is a physician and epidemiologist and professor Emeritus of Environmental and Occupational Health Sciences at the University of Washington. His career includes being Dean of the University of Washington School of Public Health and Director of the National Center of Environmental Health at the CDC. His research interests include health aspects of the built environment, climate change, energy policy, nature contact, and sustainability. He has served on as a board member of the U.S. Green Buildings Council and Physicians for Social Responsibility, among many others. He is the co-author and author of over 250 scientific journal articles and chapters and 9 books, and his forthcoming book, Planetary Health, Protecting Nature to Protect Ourselves, is coming out this summer, so look for that. Today's discussion is available in Spanish. We want to thank Carlos Diaz de Leon for translating for us today. If you would like to listen to this discussion in Spanish, there are instructions for listening to the Spanish channel in the chat. Today's discussion is in webinar format, so you are all muted. If you'd like to ask a question in either English or Spanish, please type it into the chat and we will read that at the end of our discussion, and we'll read out those questions. With that, I'd like to begin the conversation. Sandy?
Thank you, Andy. For this webinar, I want to dedicate this webinar to one of our amazing leaders, Michelle Cook from Virginia, who recently passed away due to the complications of COVID-19. We will be playing a video.
event is Tidewater Gardens, which is at the mouth of the downtown tunnel of St. Mary's Catholic Church. The community in which I reside in, we deal with tidal flooding, rain, water, huge concern for our children, our elementary and our middle school children.
When I was 3 years old, I became very ill. One day, my family rushed me to the hospital because I had difficulty breathing. At the hospital, I cried out for my mother with what little breath I had. Before I could find her face in the crowd of doctors, I lost consciousness. When I woke up, the doctor informed us that I had suffered my first asthma attack. I still suffer from asthma. Over the years, I learned more about the causes of my illness. Growing up, pollution from the freeway practically in my backyard had permanently damaged my lungs and caused my severe asthma. 3 decades after my diagnosis, children living in communities with incompatible land uses are still being rushed to the emergency room and are being diagnosed with severe asthma at higher rates compared to other communities. Recently, Harvard published a study that found that a person living for decades in a county with high levels of fine particulate matter is 15% more likely to die from the coronavirus than someone in a region with 1 unit less of the fine particulate pollution. Dr. Frumkin, the fact that communities that I grew up in are still being exposed to higher pollution and have increased risk of COVID-19. Can you explain the parallels between COVID-19 and climate change and the context of public health? And also, can you talk about how air pollution is impacting climate change and COVID-19?
Sandy, thank you very much. And before I answer your great question, let me just salute mothers out front and salute everybody on this call for the great work that the organization does, both in tackling climate change and in honoring our children and in fighting for justice as well as health. It's a great organization and it's a great privilege to be here tonight. So good afternoon and good evening to everybody. Well, how does COVID relate to climate change? I think there are at least 3 big common grounds between the two crises. One is the lesson that if we live in dangerous ways, if we dishonor our planet, if we're reckless, then that can damage our health. Now, everybody's familiar with that in terms of climate change. If we burn too much fossil fuel, if we take down forests, if we consume resources and energy recklessly, then we drive the climate into climate change, and that endangers our health in many ways. But not everybody understands that COVID and infections like COVID come from some of the same behaviors. If we take down forests and if we expand our cities into places where forests used to be, humans and wildlife have more contact with each other, and we increase the risk that we'll have infections jumping from wildlife into humans. So treating our planet with respect and reverence, being good stewards of our planet, is an important public health strategy to protect us and our children. I'll mention that some of the best wisdom along those lines comes from our indigenous sisters and brothers who know an awful lot over many, many generations about stewardship of our planet. So that's one. We need to be good stewards of our planet, and that applies both to climate change and to COVID. There's another, which is when we face a major health crisis, we're not all equally susceptible. And Sandy, you teed this up with your personal story, and thank you for sharing that. When something comes along like climate change or COVID, people who are vulnerable are people who are vulnerable. So if you're in the line of fire, so to speak, then you're more likely to suffer from whatever the problem is. And we'll talk more about the ways in which COVID disproportionately targets communities of color and poor communities. And the third I'll mention, and this is not so obvious, but it's both COVID and climate change remind us that we should never be about solving just one problem at a time. When we solve big problems, we need to solve many big problems. So we need to be fighting for clean air and for renewable energy and for economic justice and for better neighborhoods, because all of those are part of a package. And if you solve just one thing at a time, you won't get the right answer.
Back in 1987, the United Church of Christ published a study titled Toxic Waste and Race in the United States, which was the first study to examine the demographic disparities between those who live near hazardous waste sites. And the study found that race was a significant variable. Recently, the American Public Media, APM, a nonpartisan research lab, compiled data from 40 states, including Washington, D.C., that shows that African Americans are dying of COVID-19 3 times the rate of white people. The Navajo Nation, which spans parts of Arizona, New Mexico, and Utah, has surpassed and New Jersey for the highest per capita COVID-19 infection rate. And in California, Latinos make up 53% of the state cases, despite making up 39% of the state's population. Dr. Frumkin, can you explain how COVID-19 is disproportionately impacting communities of color?
I sure can, and boy, is it a tragic aspect of this disease. So there are several things going on here. One is that poor people and people of color have poorer baseline health, higher rates of high blood pressure, higher rates of heart disease, higher rates of asthma and other respiratory diseases. And if you've got those underlying conditions, you're more likely to be targeted by COVID. So that's problem one. Problem two is that if you're poor or if you're a person of color, you're more likely to be in a job that exposes you to the virus. So if you are an information technology worker, you can work from home, or you can work in, up until the shutdown, you could work in an office where you had a relatively good ability to distance from your coworkers. But if you're a delivery worker, or God save you, if you work in a meatpacking plant, you don't have the chance to distance. You're right up with a lot of people and your exposure is higher. A third issue is one you alluded to, Sandy, and that is that you have more exposure to air pollution because of where you live. We have very good data going back to the United Church of Christ study, showing that communities of color are disproportionately likely to be exposed to high levels of air pollution. And we now know from the research that you mentioned, both in the US, but also in Chinese research, that higher levels of air pollution make you more susceptible to COVID. And finally, if you're poor, if you're a member of a community of color, you've got less access to healthcare. And that matters because you may be less likely to get tested, you may be less likely to get the treatment you need when you need it. So all of those, it's kind of a perfect storm, except storms are accidental and these things are not accidental. So I wouldn't call it a perfect storm, but it's a combination of factors that increase the risk of poor people and communities of color.
Yeah, and talking about how pretty much all the ways our communities of color are impacted. Recently on Tuesday, May 19, commissioners in Franklin County of Ohio passed a resolution that declared racism a public health crisis and vowed to work under anti-racism principles. Dr. Frumkin, how does racism in urban planning play a role on how climate change and COVID-19 in its role of impacting negatively of communities of color?
Well, urban planning has a long history of discriminating against communities of color and poor communities. This goes back to the 1920s when redlining came into style. Redlining was a discriminatory practice so that if you had brown or black skin, you couldn't get a mortgage or buy a house in certain neighborhoods. So segregation was built in. Then along came practices like urban renewal that tore apart some communities of color in preferentially favored majority communities. Nowadays, there are several features in many of our cities, unfortunately, that heighten the risk if you happen to be poor or of color. Air quality is worse in the neighborhoods that are poor. Often they're very close to transportation depots. You mentioned hazardous waste sites, industrial facilities. So if you're living close to where air quality is poor, likely to get affordable, safe, clean. If you don't have access to good, healthy housing, you are more likely to suffer from a range of diseases, including nowadays in the era of COVID. If somebody tells you to go home and socially isolate from the members of your family, but if you're crowded many people into a small place, you can't do that. So having an adequate supply of good, healthy housing for everybody would be a great piece of urban planning for lots of reasons, including being resilient to an infectious disease. One other feature that I'll mention is parks and green space. Now, we all love contact with nature, and it's good for us. One of the things we've seen during the COVID era is that after people get cabin fever or get anxious or depressed being cooped up in their house, they have an urge to go to a park and get outside. We now know that transmission in outdoor spaces is really pretty unlikely. So the benefits you get of being in a park or in a natural space probably greatly outweigh the risks. But if you're poor, if you're living in a neighborhood that doesn't have good infrastructure, you may not have a park nearby. And that disproportionate access to good parks is another part of the urban planning problem that discriminates against poor people and people of color. So if you design cities to be great habitats for everybody in them, they would look pretty different than our current cities look. And that shows up in perfect relief when it comes to the COVID crisis.
Yeah, and also too, if you can explain a little bit more, Dr. Frumkin, you know, we've had shelter in place for about 2 months, and we've seen reports of cleaner air, I mean, in cities, and a drop of greenhouse gas emissions. But for example, Chicago, you know, did not see cleaner air. And so can you explain a little bit more about what's happening there and why do we see in certain areas and not?
Well, you know, it's watching the air respond to the shutdown has been really interesting, hasn't it? We're seeing reduced carbon emissions, and we're seeing cleaner air. In some places, the cleaner air is dramatically cleaner. The carbon reductions are not as big as we might have hoped, something in the 15 or 20% range globally. That's good. That's a better reduction than we've had for years, but it's not as big as you might have thought. And that is a reflection of the fact that if transportation emissions go down, you gain something in reduced carbon emissions. But our whole system, our energy use, our manufacturing, a lot of the things that are sources of carbon emissions and of air pollution haven't changed that much. So this goes to the question of how much can individual behavior change help in tackling climate, and how much do we need system change, like changes in our energy system and our transportation system. Behavior change helps. We all have to be about behavior change, but we really have to be about system change, changing the energy system, changing the transportation system, changing manufacturing practices. If we had the chance to make major changes there, we would see bigger reductions than we've even seen in the past couple of months.
And I think that's key, right? I think what you said there is systems change. How do we get to systems change, right? So at Mothers Out Front, our organizing principle is that we believe that the power of bringing mothers together, we have a powerful voice. We're a large constituency group, and we could bring that change. That change is that system change. So the question I have for you, Dr. Frumkin, is what are the lessons that we've learned from COVID that can help protect our communities from the threat of climate change? Because we want to take those lessons and use that to help mobilize other mothers and everyone else to make sure we're protecting protecting our planet, but also our lives and our future generations.
Well, I think there are a few lessons, and I think that people on this call will have a lot more lessons to pitch in once the time comes for the discussion. But One thing we've learned is that large-scale, rapid change is possible. Now, we've all been pushing for major change to tackle climate change for a long time. And a lot of times naysayers would say, well, you can't possibly switch from oil, gee, the system's too big. But look at the way we've completely changed the level of economic activity, our travel patterns, our working patterns in a matter of weeks. So we should take heart from this. This wasn't a good reason to make a change. And this particular style of changing hurts a lot of people. So we don't want to celebrate that. But we do want to take the lesson that major rapid change is possible. So coming out of this crisis, we should be as aspirational and ambitious as possible about tackling the climate crisis. Second, the lesson we should take from this is a lesson that I think we all knew beforehand, but it's been reinforced. Equity and justice have to be at the very center of the work we do, because these threats disproportionately target the most vulnerable among us. And so any solution has to have right at the heart of it equity and justice, so that everybody gets a fair shake in the new energy economy, just as we have to aspire to good medical care and good social care for everybody in the context of coronavirus. Solidarity and mutual support matter a lot. And to me, that's the third lesson from the COVID crisis. Think of all the communities across the country, and I bet most of them on this call have looked in on an elderly neighbor, taken care of somebody who needed some help, bought groceries for somebody. Who we are as a society, a lot of concern and care for each other. There are some who would say, well, we're all out for ourselves. This is all about making a profit. It's all about business. But solidarity, the heart and soul of Mothers Out Front, the powerful movements we've seen tackling the climate crisis in recent years, we're seeing evidence of that same kind of solidarity when it comes to COVID. People are willing to make sacrifices. A vast majority of Americans are willing to shelter in place and to wear masks and to behave themselves. So we can do this. We can pull together and we can tackle big challenges. And that's a great lesson from coronavirus too. Now, there are some other lessons. Good science matters. You wouldn't know that from our federal government and climate change, but good science really matters, and it's clear in coronavirus. Good government matters. It was Reagan who said government's not the solution, government's the problem. But when we tackle big problems, we need government to be there leading the way and helping. And it's clear in coronavirus that a lot of the failures of the federal government have been responsible for needless suffering and death in this country. We need good government that's really out there fighting for what's best for the American people. And I guess the last thing I'd say is, coming out of this crisis, there's a huge amount of unemployment in this country now. There's a huge amount of misery. A lot of the jobs won't come back. What a great moment for the government to invest in large-scale job programs, just like Roosevelt did during the Great Depression. Imagine if we created 10 million jobs. It could be another Civilian Conservation Corps or WPA. And imagine what we could do with all those jobs. We could be insulating every house in the country. We could be putting solar panels in everybody's house. We could be putting electric car charging stations in. We could be fixing our transit systems. And in the process, creating wonderful job skills for the people who get involved. So coming out of this crisis, it's not only a medical crisis, but it's an economic crisis, and it's a joblessness crisis for millions of people. This is an opportunity to think big, and we should take that opportunity.
Yeah, and speaking of economics, I want to talk about having more of a robust public health system integrated into the way the government responds from federal to local, because what you hear is we need the economy to reopen. We need this because we need our jobs, and it has to reopen. But as we know, when we prematurely shut down, we lost some lives. And if we prematurely open, we're seeing potential lives are at risk. And so, and with the studies I talked about with Harvard and the other APM talking about where the disparities are happening, these research points out that where the areas where we need to put PPE, ventilators. So what does that mean of having the government to have an emergency preparedness system that it's not mutually exclusive from having a good economy?
Well, it's a great question. And I think the heart of the question is that the good health doesn't have to fight against a good economy. In fact, you can't have a good economy without good health. So what we need to be about now is reopening the economy, but doing it in a way that protects people. Now, we bought some time by having the shutdown that we had. We stopped what would have been a much worse spread of the disease. What we need to be doing with the time that we bought is putting into place contact tracing, a lot of testing so we know who's positive, contact tracing so we can find whoever the positive people have been in contact with, provisions for isolation and quarantine, and that means supporting people. When we tell them to stay at home, we need to get them their food and their medications and take care of them so they can stay at home safely. To do all of that, we need to have the healthcare system ready. We need to have lots of PPE. We need to have the supply chains for testing. All of those are the steps we need to be taking now so that as we open up and as we see a resurgence of the disease, which will happen, we can handle it. We'll handle it much better than we handled it the last time because we'll have the testing and the contact tracing in place. So this is, it always strikes me that when it comes to the military, we get this. We have millions of people in uniform. They're not all fighting a war right now, but we have them in uniform and trained to shoot guns and do everything else they have to do so that if a war happens, we'll be ready. But we don't think about public health that way, do we? We should have hundreds of thousands, if not millions of people trained to tackle health crises. It doesn't mean they have to be doing it all the time, but keeping in training, keeping equipped, keeping ready so that when something happens, we have the capability of handling it. The way we handled it in the past couple of months is frankly embarrassing. Countries like Korea, Taiwan, Vietnam, Germany did much better than we did, but we need to do better. We can do better and we need to do better. So getting all that preparation in place is what we need to be about. As we do that, we can open up.
Yeah, and there's such parallel, right? I mean, how we respond to coronavirus, how we've been responding to climate change, just, not willing to really put a real plan to reduce greenhouse gas emissions, and it's taking activists to put the pressure on to make sure our government's responding. And what I want to ask you, Dr. Frumkin, in California, we see that 5.5 million residents are living within a mile of an oil or gas well, with nearly 4 million of those are people of color. Can you explain how the urgency of moving away from fossil fuel extraction can protect lives from other infectious diseases?
How the urgency of moving away from fossil fuel extraction, well, yeah. I mean, if we move away from fossil fuels, we will have an immediate bonus of cleaner air across the country. And that's at the refineries and at the transportation depots and near the roadways and all the places where combustion of fossil fuels makes the air dirty. We'll see an immediate benefit. Then we'll see a whole bunch of long-range benefits, because climate change long range is a huge threat to health in many, many ways. And almost every one of these threats disproportionately hits poor people. So let's go through a few of those. The hot weather and the severe storms and the melting of the snow caps means that we have more forest fires, which I know you in California are very familiar with. Forest fires create high levels of smoke, which are very bad for people's heart health and lung health. Climate change increases the risk of some infectious diseases, not necessarily COVID, but diseases like Lyme disease and dengue fever, where mosquitoes and ticks expand their range. The risk of those diseases rises. Climate change is going to threaten us with nutritional problems because it's going to cause farmers to be unable to grow their crops around the world. And when that happens, food gets more scarce, prices go up, And guess who's hardest hit when the prices of food go up? It's people who are food insecure. So this is an environmental justice problem. Mental health. All of us are now living under the knowledge that our planet is in deep trouble. But if we got off fossil fuels and we're moving toward a clean, green economy, there would be much more confidence that there's a future for our children that we want to leave them. I think levels of anxiety and depression, especially among our young people, would drop. So the immediate benefit of getting off fossil fuels will be cleaner air, lower rates of asthma and heart disease for people in polluted areas. But the long-term benefits are just enormous across a whole range of health problems. It's really urgent that we get off fossil fuels for all those reasons. This was the biggest public opportunity we've had in my
So, Dr. Frumkin, can you hear me? I think it's cut up here.
I think we had a drop out there for a moment, but I can hear you loud and clear now, Sandy.
Okay, we're back on.
Yep.
So,
we're all used to this in the Zoom era, aren't we?
yeah, this is our new era, living in the Zoom space. So the other question I have for you is really about environmental justice. You know, Dr. Franken, can you explain how environmental justice principles are crucial to consider in urban planning?
Well, yeah, if you were going to create cities that were healthy for everybody, then you would provide for all of the basic human needs for everybody in the if you do is to be physically active, access to good food, company of other people, but also some privacy. And so if you design a city around those human needs, you begin to create cities that are truly healthy for everybody. Now, we mentioned earlier a couple of the basic urban planning principles that would tackle environmental justice concerns. Housing, housing, housing. Our cities are too short on housing, and that means that people are having difficulty finding housing. Too many people are homeless. There's anxiety and depression among people who don't have housing, and that is a huge health problem as well. And the housing has to be healthy housing, without moisture, without infestations of vermin. And before I go on, let me just interrupt myself and ask if I can be heard now, because my screen just went blank. Can I get
we can hear you.
Okay, good. Yeah, I'm not seeing you anymore. There you are, you're back. So, adequate housing in cities, adequate mass transportation and cycling and walking infrastructure, because we need to get people out of vehicles. We have an obesity epidemic and a sedentary lifestyle epidemic in our country with lots of health consequences like heart disease. But if we all were more physically active, that would help a lot with that epidemic. And by the way, if we get out of vehicles and we walk and cycle, then we have fewer car crashes and we have cleaner air. So it's a win-win-win. Good food availability across cities has to be central to good urban planning. If you live in a neighborhood where the only place to get food is a convenience store and all you can get is processed food, or if the fruits and vegetables that are there are too expensive, then it's really tough to maintain a healthy diet. So having a good system of farmers markets or of other kinds of stores where people can get good food, having plenty of parks and green space and making sure that they're equitably distributed is an important principle of city planning. And then as we improve our neighborhoods with better sidewalks and better parks and more tree canopy, we have to take steps to be sure that that doesn't turn into gentrification and drive people out of their communities. So that's a matter of social policy. Cities need to put the policies in place, and there's no easy answer on this one, but as much as possible, let communities stay where they are as their neighborhoods get better.
Yeah, we see that as a political, as far as a political decision, right? Because when we talk about what can help with health, you know, what can make a healthy city, it's not a mistake, right? It's really by design and having a built environment that is going to allow people to have access to jobs, have access to mass transit, have access to green space. And all those things are important. I mean, important for environment, and also too important for like anything that can happen. For example, right now, the pandemic that we're in, as we've seen of all these disparities and being exacerbated during this pandemic. So as we know, that type of structure, that built environment, right, comes really, the strength of it comes from community, community-based science, community knowledge, community intelligence. And, at Mothers Out Front, we're a national organization, but we have, chapters locally, and we have moms talking to local officials and what that design looks like. And can you describe, like, Dr. Frumkin, what cities have you seen that have made that choice, that decision, that have designed it in a way that's built it to help families, and also to what are like the lessons we can learn from that other cities and other folks can follow?
Well, let me give a few examples. I hope you'll forgive me if I talk about my own hometown, Seattle, because we've done some great things there. Just in the last couple of weeks, the mayor has announced a really neat plan in Seattle. Now, in many cities around the country, including Seattle, some streets have been given over from cars to walkers and cyclists during the COVID time because people are driving less and they need to be out walking more. Well, Seattle is going to turn miles of streets permanently back to pedestrians and cyclists and take them back from the cars. But the cool thing is, if you look at the map of the city, what the distribution is of those streets, they're predominantly in South Seattle, which is the low-income part of the city. And that was done in a very deliberate effort to provide the benefits to the most vulnerable parts of the city, where they haven't always had good bike and pedestrian infrastructure. So as you move toward better walking and biking infrastructure, put it disproportionately in the neighborhoods that lack it and where health would benefit greatly from having it. So there's one example. Another example is public housing in Seattle. There's been a real push over recent years to build public housing that is asthma-safe public housing. And that means using materials that don't off-gas and having air supply systems that provide plenty of fresh air, and having construction such that you don't get a buildup of cockroaches and other antigens that trigger asthma. So not just building public housing, but building public housing that is clean. And by the way, it's environmentally safe and low energy and efficient and really attractive. So great public housing that promotes both the environment and people's health. And Seattle is only one of many good examples of doing that. And now I'll go for an example to overseas. We'll go to Curitiba, Brazil, or Bogota, Colombia. A lot of the Latin American cities have been real pioneers in bus rapid transit, where you take a lane of a street, you dedicate it to buses. It's not as nearly as expensive as building a subway or a trolley line. You can get it into action quickly, and you can move people very quickly, conveniently, and cheaply. That's great public transit. And guess who it serves? It's the people who have to travel distances to get to their jobs, many of the poor people. So good public transit, good walking and cycling infrastructure, good public housing, and all of that can be good for health and good for the environment. And so there are good models out there.
So right now we're going to open up questions from the chat. Andy, you want to provide questions, Dr. Frumkin, from the chat?
Yeah, I just wanted to say thank you so much for that wonderful conversation. I was just struck that we know the policies that would help us. The technology is there, and we just need the political will to make it happen. So I thought that was very clear. We have a question that asks, do you know of any research in the USA to follow up on preliminary Chinese research that suggests that COVID-19 can be transmitted via fine particulate matter?
There is research going on both about droplets and about the tiny particles that people exhale. Actually, I should pause and say, this is a question that may be about air pollution, fine particulate matter, not the fine particles that we exhale. that contain COVID. So in terms of transmission by air pollution, no, I don't know of any US research on that. We actually have a fair amount of research happening here about the ways in which people transmit it through the air they exhale. But having jumped into answering about that, I think that wasn't the spirit of the question. So as far as regular air pollution, fine PM, I don't know of any research that links that with COVID transmission. Doesn't mean there isn't that research, I just don't know about it.
I the person asking the question may be talking about rather than transmission, but the correlation between the higher morbidity and mortality in communities that have higher particulate matter. Perhaps you could speak to that.
Right. Well, so there were at least two things there that are hard to disentangle, right? If you've got more fine particulate matter in the air, that could mean that you've got more COVID virus traveling with it. So maybe it means more exposure, but it also means that you've got more exposure to the air pollutant, meaning that you've got more vulnerability because of the air pollution. So you're liable to get sicker given the same amount of virus exposure. So whether the particulate matter functions by being a carrier for the virus and/or it functions by making you more medically susceptible, it's pretty hard to disentangle those two things, and I don't know the answer. But it is clear that people living in areas that are more polluted are getting sicker from the virus.
Thank you. We have another question. They say, thank you for expressing that equity and real justice are all a part of the paradigm shift needed. Can you address the concept of food and land sovereignty in terms of emerging from the pandemic with real food security, including access to land to grow food?
So, boy, I wish the questioner were on the line so we could get a clarification, but I'm guessing this is a question about rural areas and land rights. And I'm guessing it's a question about the US, although the land rights issue is a huge problem in the low-income countries of the world as well. So I think in general, we're seeing pressure on land. We're losing arable land as cities expand and as suburban development takes place. And by the way, there's pressure on land from climate change because large parts of our agricultural land are becoming either too dry or too hot or both to continue in agriculture. So, Mark Twain said, buy land, they aren't making it anymore. It's a finite resource. It's actually a shrinking resource. And as more of it has gone into industrial agriculture in the hands of very large property owners, less and less stay in the one bad way are more likely to be. The problem is going to be changing our whole concept of land use and land ownership, moving back toward and stewardship of the probably intensification of agriculture in the industrial sense to be more efficient in their yield. We need to get as much as we can out of each acre of land. And we need to move toward maintaining soil that's healthy and maintaining water supplies that are sustainable so that we can maintain a healthy food supply for everybody. That's going to be one of the big challenges of climate change. What keeps me awake as much as anything is the food issue.
We have another question that they ask, has there been any modeling done about how universal basic income could improve public health outcomes? And if not, are there any possibilities to test this out?
That's a great question. So I don't know of any studies looking at the relationships of universal basic income to health. I know there have been trials of universal basic income in Finland. There were a couple in Canada. Rutger Bregman, the wonderful Dutch economist, has pulled a lot of this together into his great book called Utopia for Realists, which I'd recommend for everybody, but he doesn't touch on the health benefits. So I think it would be studyable, and probably some of the existing data would yield health insights if we looked at it. But I don't know of anybody who's done that work yet. I really appreciate the question.
Yeah, if there's any researchers on the line, here's a great research question.
Yes.
Well, it looks like we've gone through all of the questions, and I know that Sandy has some actions for all of us on the phone today that we can do to take action on climate change right now. So she's going to talk about those.
Thank you, Andy.
Thank you, Dr. Frumkin.
Yeah, and those are great questions. I was inspired by the quote from Dr. Catherine Hayhoe from Texas Tech University. She said, climate change is the most political science because it's going to take mobilization of mothers and everyone to achieve climate justice. So right now at Mothers Out Front, we encourage you to go on our site, and we're going to put the link in the chat to tell the Environmental Protection Agency that this is not the time to roll out any standards. We need standards. We need those protections, as you've heard of how communities are being disproportionately impacted, not just by pollution, but also by this disease. The other action that we have is an action towards Speaker Pelosi, that we don't want the fossil fuel industry to be bailed out. So I'm also going to put in the link in the chat where you can sign our petition, but also to make a phone call to her office to demand that no relief is sent to fossil fuel industry, but to the people that deserve it. And last but not least, if you are in California, we do have a mission to Governor Gavin Newsom and to CalGEM to establish a safety setback rule 2,500 feet between fossil fuel extraction and homes, schools, and other sensitive sites. We really encourage you to take action with us, because without us and without us mobilizing together, we know what the dangers can hold. So our voices matter. So please click on the links. It will be in the chat, and join us.
We have a late breaking question, which I'm just gonna, I want everybody to have a chance to ask their questions while we have Dr. Frumkin with us. So I'm gonna ask this even though we had closed that up. This person asks, it seems that our carbon dioxide emissions is reduced by less than dramatic amounts because we have been driving less. If you were to choose a place to start to address the baked in greenhouse gas emissions, where would you start?
Fossil fuels for energy.
Fossil fuels for energy, meaning?
Meaning that if we switched away from burning fossil fuels to make electricity, and we've done a switch in recent years away from coal and toward natural gas. Some places still use petroleum, but if we were to switch rapidly from that set of fossil fuels to wind and solar, and some energy conservation and a smart grid, so that all of our electricity became clean. And if we switched our transportation system over to being electric, drawing from that clean electrical system, we would probably knock down our emissions by 30, 40, 50%. We know that transportation is something like a quarter to a third of our carbon emissions. A lot of that's happening despite the shutdown because of trains and trucks and so on. And we know that energy generation is another quarter or more of our carbon footprint. So moving to renewable electricity, both for electricity in our homes, in offices, and also for transportation would be a huge den. So all the work you're doing about pipelines, shutting down refineries, that's exactly on point. That you're great public health workers to do that work.
Well, thank you so much, Dr. Frumkin, for your answers and for having this conversation with us today. And thank you, Sandy, for leading the conversation. We want to thank all the participants for joining us this evening. And we wish you a good night. But before we do, we want to just remind you to take action at the EPA. And then if you're in California, to take action in California. We'll give you 1 minute to do that, and then we will say thank you and good night. The links are in the chat, and you can just click on the links in the chat and make sure that you just take a minute to contact Nancy Pelosi and tell her how important it is that we have clean energy in the stimulus. All right, everybody, thank you so much for your time. Thank you, Dr. Frumkin. Thank you, Sandy. And we will see you again soon for another conversation, hopefully. Thank you.
Thank you very much. Good night, everybody.
Good night.
Be safe.